Welcome to the Preparing for Childbirth podcast, where we'll talk about God's amazing design for childbirth. Learn how to prepare for the unknown, handle the pain, and lean into God's character through it all. I'm your host, Jenny Childs. I'm a follower of Jesus, a wife, a mom, and lover of all things childbirth. Thanks so much for joining me today. This is episode 5. Today's show is not only for anybody who's pregnant, but for anybody even thinking about getting pregnant. I want to spend some time today talking about choosing a care provider. Now, the ideal time to do this is early in your pregnancy or even before you get pregnant. Hang on though, even if you already have a care provider or you don't feel like you have a choice, I think parts of our conversation today will be relevant to you as well. So stick with me while we think through this topic of choosing a maternity care provider. In this discussion, we'll also talk about choosing where you want to give birth. In fact, that may be the question you should answer first. In general, the options break down into 4 categories: hospitals, in-hospital birthing centers, freestanding birthing centers, and at home. Obviously, not everyone has access to all of those options, so it's important to find out what's available in your area. With my first pregnancy, there were no birthing center options in our area, and my husband was very uncomfortable with a home birth, so that narrowed things down for me to hospitals. We moved to a new area before our third child came along, and there I had the option of a freestanding birth center. It was a bit of a drive, but for me it was worth it. We might have been ready to consider a home birth at that point, but the legalities surrounding home birth in that state more or less took that option off the table. Now, as you're considering where you want to give birth and who you want your provider to be, there are 2 different types of maternity care to be considered: midwife-led care and physician-led care. Both physicians and midwives are highly trained and skilled at what they do. The medical model tends to rely more on interventions and technology to achieve good birth outcomes, while the midwifery model tends to lean into and encourage a woman's own physiological and psychological resources for giving birth. That just means that a midwife is more likely to be patient with and encourage the normal functioning of a woman's body, and often pays more attention to how a woman is thinking and feeling about her pregnancy and birth. That's not to say that a doctor won't do those things. You will find doctors who follow more of a midwifery model and midwives who follow more of a medical model. But generally, doctors tend to focus more on the medical side of things because they've been trained to effectively use medical interventions to deal with or even prevent problems that may arise. For higher risk pregnancies, that is a very good thing. You need the medical expertise of a good OBGYN or even a maternal fetal medicine specialist. Midwives are prepared to handle problems that come up, but they'll try to use interventions that will cause the least disruption to the physiological process first. They've been trained to have a deep respect for that physiological process. If a serious problem arises, a midwife will refer you to a physician. A midwife can't perform a C-section, for example. So, if a C-section were to become necessary during a home birth or a birth in a freestanding birth center, the mama would need to be quickly transferred to a nearby hospital. Midwives are prepared for these eventualities with backup physicians, and they know just what to do to get you the care needed. In a systematic review comparing midwife-led and doctor-led maternity care, I'll put a link to that article in the show notes, the researchers draw this conclusion, quote, "For low-risk women, health and other benefits can result from having their maternity care led by midwives rather than physicians. Moreover, there appear to be no negative impacts on mothers and infants receiving midwife-led care." End quote. Other studies show that in low-risk pregnancies, midwifery care in labor is associated with decreased interventions and decreased C-section births. In Great Britain, the National Institute for Health and Care Excellence says that evidence shows that midwife-led care is safer than hospital care for women having a straightforward, low-risk pregnancy. Something to think about. So, again, there's several things to think about when choosing a care provider and a birthplace. What approach to maternity care do you prefer? Is your pregnancy low risk? Does it matter to you if your caregiver is male or female? That would just be a personal preference. And what options are available to you? Insurance might also play a part in that. Now, looking at the options you have available and thinking about your own personal needs and preferences, you'll have to make a decision about which is the best fit for you. You can ask questions to gather information to help you make your decision. What questions you ask will depend on your priorities, and in the show notes, I'll link to some articles that give lots of ideas of possible questions to ask. There's not necessarily a right or wrong to this decision. What is a good fit for you may not be the best fit for someone else. Make the best decision you can and trust God. My sister had a higher risk pregnancy and needed the medical expertise of an OBGYN. She also desired to use as few interventions as possible during her labor. Her doctor listened well and supported my sister and her husband with their choices for the birth. But here's an example of holding your plans loosely. After laboring for about 12 hours in the hospital, their little guy ended up presenting brow first, making it dangerous for him to pass through the birth canal. So they ended up with a C-section, for which they were very thankful. Ultimately, your hope should not be found in having the best birthplace and the best maternity care provider. God is the Good Shepherd, and He is the one who is ultimately in control. He may allow everything to go smoothly with your pregnancy, labor, and delivery, or He may allow difficulty and trial. Either way, I encourage you to lean into Him, Mama. If you are His child, I assure you that He is always working for your good and His glory. Maybe you already have a maternity care provider, but you're seeing some red flags. That might look like a provider that's dismissive or inattentive to your concerns, or who's in and out so fast in your appointments that you don't have time to ask questions. It could look any number of ways, really. I want to encourage you not to feel stuck, but I don't want you to run at the first sign of difficulty either. In the scenario I just mentioned, you could try letting your provider know you have questions at the beginning of your next appointment and come with them written down so you won't forget. And then see how she reacts. Does she slow down to listen and take time to answer? If not, you might be concerned the same could happen during labor. Don't be afraid to change providers. Most of the time, this is not as difficult as it might feel. It is good for you to feel comfortable with your care provider. Of course, you might have little choice over the attending doctor or midwife at your birth. You get whoever's on call. That's okay too, Mama. Remember, ultimately, the best decision you can make is to place your hope and trust in God. Even the best doctors and midwives sometimes fail, and the best birthplaces sometimes don't deliver the amazing experience you were hoping for. Don't put all of your hope and security in those things. As Psalm 46:1 reminds us, God is a refuge and strength, an ever-present help, no matter what happens. Obviously, you can't always have exactly what you want, but hopefully the information I've shared in this podcast will help you make the best decision you can based on your options. Then trust God with the rest. If you've enjoyed today's podcast or found it helpful, I hope you'll share it with a friend, and I'd love for you to leave a rating and review. Thanks for listening today. It's my prayer that these podcasts will help you grow in confidence and peace as the day draws near for you to meet your little one. I'm so glad you tuned in today as you are preparing for childbirth.